So, hello, Pat Anderson. This short recording is a brief interview with our visiting professorial fellow in the Faculty of Health at University of Canberra, Pat Anderson.
Morning, Joe.
Pat, we know that you've got a vast experience in Aboriginal health and in Aboriginal education. One of your roles is chair of the Lowitja Board, the Lowitja Institute Board. Can you tell us a bit about what the Lowitja Institute is and what it does?
The Lowitja Institute, that's the short title for it, it's called the National Aboriginal and Torres Strait Islander Health Research Institute. It's a first, and it's a great challenge, it's ambitious, but there are lots of other agencies that do work and have done traditionally for a long time as well in Aboriginal health. And most of those are our partners, like the Menzies School of Health in Darwin, for instance. But we, the Lowitja Institute, we deal exclusively, only with Aboriginal and Torres Strait Islander health issues and all the other associated underlying causes and the whole gambit of issues which might come under a huge title like research. So that's our main focus. And that's what we do, and it's a national institute, like I say, a new challenge.
So on the Lowitja Institute website, students would find a great wealth of material written by and from an Aboriginal perspective too about health?
Absolutely. Now, let's qualify that a little bit. A lot of the research, especially because the Lowitja Institute is a legacy of CRCs, which go back to the original from the early 1990s. So we've had nearly 17 years experience exclusively in this field of Aboriginal health research. So some of the researchers in the beginning were always expert in their particular field, but non-Aboriginal. When we started the Lowitja Institute, for instance, as far as I'm aware, there were only two Aboriginal researchers in the whole of Australia, and that was Ian Anderson, Professor Ian Anderson now, and Professor Marcia Langton, and that was it. There may have been a few other people, bits and pieces around in various universities, but they were the only ones that were out there, if you like, on the national scene, and so they were the only ones. And now we have a couple of cohorts of Aboriginal and Torres Strait Islander researchers who are actually out there practicing their craft and earning experience and gaining experience as quality Aboriginal health researchers. So that's a big change, and that's a big influence, I think, in the Lowitja Institute. And of course, during this period of 17 years, as I was saying earlier, we have now Aboriginal doctors, nurses, midwives, physiotherapists, psychologists, dentists, a whole gambit of professional and paraprofessionals working in the health field. I mean, when I was growing up as a kid in Darwin, we had one Aboriginal nurse, and now she's Professor Marianne Bensellick, retired, but she was the first. She was one of the first. And of course, Lowitja O'Donoghue preceded Marianne. So there were ones and twos around and scattered across the whole nation. So that whole face of Aboriginal health has changed dramatically in the last 17 years. But it started, of course, with the first Aboriginal medical service being set up in Redfern in 1971. So we have three or four generations now of people who are very savvy about health and health issues and can debate and be part of a national discourse around, the frameworks such as useful framework, the Social Determinants of Health, which include environment and effects of colonisation and the social issues, which AMSs knew about even in 1961, because that was our experience. It's not just access to doctors and hospitals.
Absolutely.
It's much more than that.
Yeah.
So there's a very rich and a very robust legacy that trails behind the Lowitja Institute. We wouldn't have thought 17 years ago, for instance, and I didn't, because I was part of the original, all the discussions that went on before we even got the first CRC for Aboriginal and Tropical Health, that we would, in fact, one day I'd be sitting around talking about the Lowitja Institute.
Yeah.
But during that 17 years, I thought, we can do this job.
Absolutely.
We can do this, and here we are now.
Yeah, and congratulations on your leadership. I know you haven't done it alone, Pat, but you have been there for a very long time. And you mentioned growing up in Darwin, and I know that you returned to Darwin at one point and spent a long number of years running an Aboriginal medical service in Darwin. Tell us about Dunella-Dilba.
Yeah, that's the Dunella-Dilba Health Service in Darwin, which services the Darwin population and the outlying areas. And of course, it's the main focus for when Aboriginal people come in, either from the centre or from the top end. Anybody who's in Darwin, Aboriginal or Torres Strait Islander person, they can come to our service. And we operate like all AMSs do. That's Aboriginal Medical Services or Aboriginal Health Services around the country. We decided in 1971 that we would set up these Aboriginal Community Control Health Service, and we would deliver to our communities comprehensive primary health care. So we did that like all the services do, but also too, there's a whole range of other services that we provide, like emotional and social wellbeing centres, parenting courses, explaining to parents why it's important to get their kids to school, and also to writing letters for state housing. Doctors' letters and doctors' notes for why this family needs a house like now, and can they go to the top of the list. We've always done that kind of, I suppose, using an old word, that kind of in that category of sort of welfare, because that's part of, people have to be housed properly, they have to be in, gainful employment. So all of those things that surround and are the underlying causes for the social determinants of health. We have been doing since 1971.
Yeah.
But now it's got much more status now, because academia has discovered this and put a label on it, the social determinants of health. But we've been doing it since 1971.
Yeah.
And we're not going to quibble.
No, exactly. But I do think that's a really important point for students to understand. In some ways, the language about social determinants of health has arisen entirely from understanding about Indigenous health.
Yes.
And the Australian story is a big part of that story, isn't it?
Oh, it is, because Aboriginal people were in Russia at Alma Ata and were part of the drafting team that actually drafted the Alma Ata Declaration. And we were able to do that because we were already doing that. That was in, I think, 1976 or 78. And we had actually set up the first service in Sydney in 1971. But there was a whole lot of discussion around that which led up to 1971. So we were able to actively participate because we were already doing it. It says in the Alma Ata. I would encourage students to read it. It's not very big, and it's really an interesting document.
That's an excellent place to finish, Pat, because I couldn't agree with you more. Public health students do know about it. Many other students would be amazed and really, really fascinated to learn how influential our Australian Aboriginal health story is in the global discussion about public health.
Yeah, and it's to do with all the social aspects and underlying causes of people, marginal people often. So read it. You'll enjoy it.
Excellent. Thanks, Pat. That's